One of the things I see argued all the time is the COVID vaccine shouldn't have been called a vaccine. It's a gene therapy.
If you are giving a genetic material to a patient to confer a therapeutic or prophylactic endpoint, you're administering a gene therapy. There's no denying it, except by the fact checkers and the propagandists. When I said this early
Hmm.
on, I got hammered for it, just unrelentingly. But you can't deny it is what it is. It is a gene therapy. You are administering foreign genetic material to a patient in order to produce a medical benefit. Why have they wanted to deny that it's a gene therapy technology? Well, because there is a big established body of regulatory science and regulatory policy about what you're supposed to do when you're developing a gene therapy before you ever put it in patients, among which, by the way, is shedding studies. They were in total denial that shedding was even possible, but now the data are coming in and not so much. It's looking like it may well be happening in some subset of cases by various routes, not the least of which may be respiratory exosomes. And so, what bothers me about Peter Marks and Operation Warp Speed, the logic is that we can jettison basically regulatory wisdom that's been accumulated over decades because it's burdensome. The reason why the FDA is burdensome is because they don't think very well and they tend to be really dogmatic. And so they insist on a lot of extra studies that don't necessarily need to be done. But there is a body of knowledge that's been established internationally about what you need to do to avoid causing harm to human beings through pharmaceuticals and biologics. And each of these regs is there because something happened at some point in time. What Peter Marks was promoted for into his position, who's the guy that created Operation Warp Speed. And on the biodefense side, the DoD side, it comes from Bob Kadlec, who used to be the Assistant Secretary for Preparedness and Response. So these two guys get together and they basically said, let's throw out the rules we think are inconvenient because this pathogen is such a huge threat. We're going to have mass death and death in the street and da 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 da. So we got to throw the rules out and we got to jam this thing through as quick as possible. But it turns out that the rules, particularly relating to development of gene therapy products, were there for a good reason, and they probably should have been followed. They shouldn't have jettisoned them, and they should have allowed alternative therapies to flourish, like hydroxychloroquine, ivermectin, celecoxib, famotidine, so many other things that were in protocols, dexamethasone, etc. And treat people early. Don't wait until they get really sick, and then come back when your lips are blue. All that story that I
Hmm.
talked about on Joe Rogan so long ago. There's things that could have been done, but they became obsessed with this shiny object of this technology. And that, Dell, is a human story. That fascination with shiny things gets us in trouble all the time. And that's why it's useful to have gray hairs around like you and me that have been on the block a few times and can say, hey, as you said just a little while ago in this program, hold on, wait just a minute. Let's think this through again. Maybe we have some other options. And instead of just trying to jam this cool, new, shiny tech through the system by throwing away the rule book and then dealing with all of the problems, not the least of which is this huge amount of damage that's been done to the public health enterprise. I absolutely support the thesis of Turtles All the Way Down, that we need to have better controlled studies to establish what the true risk benefit is. But we're now in a situation, as I've heard you point out, where a large fraction of the American public in the world have become full-on anti-vaxxers
Yeah.
because they just don't trust the government anymore for good reason here. I think the big tragedy here is that in their rush to push all this stuff through us, they caused unnecessary death, unnecessary harm, avoidable harm, disillusionment, social strife through their propaganda and their censorship and their defamation and their gang stalking, sponsored CDC sponsored gang stalking of physicians through the Public Good Project and the Shots Heard Around the World program. All of this stuff has just been enormously damaging and was avoidable. They didn't have to do this.